always want to use the 6 rights of medication administration. So you want to make sure you have the right patient, the right medication, with the right dose, the right route, at the right time, and the right documentation. So I'm going to go and wash my hands. I'm going to go over here and look at my physician's orders and my medication administration record. For my patient Skip Rucker, there is a Manto 0.1 milliliter intradermal injection to be done today to report results to the physician in 48 hours. So I'm going to go into my medication room. I'm going to find my vial for the Manto. Going to check for any cracks and particulates and the expiration date. Since it is a multi-use vial, I'm going to write down the date, the time, and my initials. I'm going to roll it. You don't want to shake it, otherwise there will be air bubbles. I'm going to take off the cap, open up an alcohol swab, clean the top of it, and I'm going to pick out my needle. I'm going to put the needle cap on a clean surface. I'm going to draw in 0.1 milliliters of air. And then you want to inject it at an angle. Then you want to put the air in, flip it to 90 degrees, and pull out 0.1 milliliters. You can tap it if there's an air bubble. Then you want to invert it, set it down, pull your needle out, 0.1. And then to cap a sterile needle, you're going to scoop it and not have the needle touch anything. And then you can secure it at the hub. You only want to do this with a secure needle or with a sterile needle when you're taking it into your patient's room. If this was a contaminated needle, you would either put it straight into the sharps, or if the sharps container is across the room, that's the only way that you can cap it and put it in the sharps container. So I'm going to take this and my vial into the patient's room. Going to knock on the door, introduce myself. Hi, I'm Abby. I'm going to be your nurse today. I'm going to get 2 patient identifiers. I'm going to look at their wristband and ask them their name and date of birth. Okay. I'm going to check their MAR, make sure that I have the right patient, look at their allergies. They're allergic to Celebrex, and so this will be okay. I'm going to check that I have the right patient, the right medication, with the right dose, it's the right time, and the right route. So I'm going to explain the routes for the intradermal medication. So the intradermal injection. So you want to put it here on your forearm. You don't want any moles or tattoos that you want to put it on. Or you can put it on this part of your back. So I'm going to get my patient in position. I'm going to put his left forearm out. This is my patient. I'm going to apply my gloves. I'm going to use an alcohol wipe to clean the area. You want to start in the middle and go outward and allow for time to dry. I'm going to uncap my needle parallel to my body, You want to insert it with the bevel up at 5 to 15 degrees. So you're going to inject it slowly. And you want the bevel to be covered, so about 1/8 of an inch, and you can still see the needle through the top layer. You're going to insert, and you want a bleb or a wheal to appear about 1/4 an inch in diameter, which my tomato is not making a bleb, but that's what you would normally look for. And then you want to take it out, put it into the sharps container. You can blot it with a gauze pad. You don't want to rub it or put a Band-Aid over it. What you're going to do is put a 1-inch diameter circle around your bleb, and you're going to tell them to come back in about 48 hours and then have a nurse check it again to see if there's any redness or anything. And at this point you're going to want to go do your charting, your documentation. So you're going to chart that you gave the manto at 0.1 milliliters intradermally. You're going to chart the time that you did it, the area that you did it, their left forearm, the lot number on the vial that you used, and then the date and time.